Over 4,200 COVID cases have been reported in Karnataka, with Bengaluru reporting nearly 85% of the state's cases. Doctors are worried about the doubling rate of cases in the state. Private hospitals and private medical colleges have been asked to reserve 50 to 75% beds for COVID patients.
Bengaluru markets crowded as ever, despite numbers spiraling in Karnataka, record daily spikes 2 days in a row. Nearly 4,246 have tested positive for COVID in the state, with capital Bengaluru contributing nearly 85% of the state's cases, with 3,605 testing positive. With the rising numbers, hospitals are reporting a sudden spurt in OPD consultations.
In December, we were averaging maybe maximum 10 people a day in the wards, and maybe anywhere from 2 to 5 people in the ICU. But the numbers were low. In the last week, we have seen a dramatic increase in the admission rate.
In order to ensure the city does not run out of beds, Karnataka government has now mandated private hospitals and private medical colleges to reserve 50 to 75% of beds for COVID patients.
If I had 5 patients in the ward at the end of December, we're seeing about 25 patients in the ward currently.
And I think
Dr. Shailesh, working at Aster CMI, says the hospital has seen an increase in hospitalization in just 24 hours.
We had around 4 or 5 cases a week back, and now we are having around 10-11. In the last 24 hours, we have had some 4 or 5 admissions. So that is like probably a spurt which has happened.
While Karnataka's testing numbers have hovered between 1 lakh and 1,20,000, home collection of RT-PCR has doubled in a matter of 3 days.
The last 10 days of December, we will be doing, let's say, close to 100 numbers. And now we have crossed close to 200 numbers in the last 3-4 days. And it's keeping on climbing as we speak. During the second wave, Bengaluru's health infrastructure had collapsed. Speaking exclusively to NDTV, D. Randeep, Health Commissioner, described how the state is trying to ensure hospitals can handle the extra burden in the third wave.
presently we are seeing a hospitalization rate of well under 2 to 3%, while daily admissions have increased in the Bangalore city area from around 15 to 16 earlier to about 50 to 60.
At present, there are 50,000 odd beds across the government and government medical colleges, across all the 4 categories, including general wards, HDU, ICU and ICU plus ventilators. In the coming days, because of the cases spiraling, the government now plans to add more ICU beds in the district level and taluk level hospitals. In Bengaluru, with camera person Govind Murthy, Shrija for NDTV.